Spending on healthcare in the United States is 19% of GDP. It is the largest industry by far. Studying healthcare management and being involved in trying to improve the delivery of healthcare in the US is both a noble and a practical endeavor. And then on the policy side, there's always a lot of push and pull and increasingly arguments of misinformation or disinformation and things like that. So it's really important to have well-trained, rigorous thinkers in the world of health policy if we're going to improve the health for all across the United States and the world. So she has a legislative fellows program where she trains students and they're going and providing legislative research support to the state of Connecticut's legislature. That linking of research to the teaching and then giving the students an opportunity to take that research sort of expertise that they're developing and deploy it to affect policy is a real strength of the department. We have two faculty members, Chima Undemele and Jacob Wallace, who are working on issues around Medicaid policy, and in particular thinking about how to make Medicaid more efficient from an administrative perspective and to help people who are in the Medicaid program make decisions around being enrolled, perhaps choosing between plans in states that allow for some privatization of Medicaid and choice, and a lot of work around how to make that Medicaid system better using some economic techniques. Zach Cooper's work, he's been working a long time on really high-level problematic health policy issues around the delivery of hospital care, billing for hospital care, and the relationship between that and insurance. And most recently his work has led to changes in how we think about balanced billing. And so Zach did a lot of work showing the negative impacts of these balanced billing practices, which ultimately led to federal legislation to change that. And then we have other faculty who are working in the areas of mental health and substance abuse policy. They're thinking about the delivery of healthcare services for those with mental health, whether they can be delivered more efficiently, and also thinking about those areas of mental health care services that perhaps aren't efficient and are consuming resources that could be deployed elsewhere in areas that would be more effective. We have two faculty members in particular, Jamie Tam and Abigail Friedman, who are still thinking very hard about the problem of tobacco and its consumption and the issues around that, particularly as it relates to children and things like electronic cigarettes. We have Jason Schwartz, who's been working hard on thinking about things like the groups that make decisions around vaccines and whether they're to be approved. And this has been a serious question, and people hesitate actually to get the vaccine still because it hasn't gone through the traditional FDA approval process the way vaccines historically did. And he's done a lot of work along with one of our senior colleagues, David Paul-Thiel, in thinking about policy modeling around how people respond to these different bits of information that come out about COVID vaccines and other COVID prevention measures. When the pandemic first started, they were integral to the state of Connecticut, Yale University, and some of what they put out was a model used around the country by other universities and other states for COVID mitigation measures. So if we're talking about real-world impact, we have faculty that are doing work that's changing lives day by day.